Today we're going to talk about neonatal care of puppies, kittens, and foals. So it sounds like a lot of fun, but there's a lot of differences and changes that happen as puppies, kittens, and foals are born, and some problems that can occur in the early days to weeks of their life. Not going to go through the learning objectives. We're going to just jump right into it. But it is something good to review when you're thinking about with each chapter, what do you need to know? So, things that you need to know about neonatology. The first 2 to 4 weeks of a puppy's or kitten's life, they depend fully on their mothers for nutrition and care. And if their mothers aren't available for that, then that is something that you need to know how to provide for them. Some equipment that you're going to need for examination, a pediatric stethoscope with a 2 centimeter bell. That's the small bell on the side that allows you to hear um, smaller heartbeats, much quieter sounds than you would normally need to listen to with the other side of the stethoscope. Your digital thermometer must read as low as 85 degrees Fahrenheit, and most thermometers don't go that low because there's really no reason to go that low. But if you find a basal temperature thermometer, those are lower temperature thermometers, but they are you have to make sure that your digital thermometer reads pretty low. You want to have a warm, clean surface for examination, and often you want to have a clean towel because, again, you want to keep their body temperature at a certain level because they cannot regulate their body temperature for the first 2 weeks of life. They don't have that shivering mechanism that helps to heat up their body. They don't have extra body fat, that kind of thing. So when we do a physical exam on these guys, again, we're going to use that special equipment. We're going to check their hydration status. We can't check their skin turgor. Now, normally when we check hydration status on a physical exam, we may pinch the skin and make sure it snaps back into place. That doesn't work with these guys. The elasticity, the fat in their skin isn't the same as it would be as they get a little bit older. So we want to check their oral mucous membranes, make sure that they've got some moisture on their mucous membranes. Body hair that should cover most of their body except for the ventral abdomen. So tickle their tummy, there shouldn't be a lot of hair there. But all over the rest of their body, there should be a lot of hair. If there is a lack of hair or sparse hair, it means either there's a genetic abnormality or there's been a premature birth. So this puppy that looks kind of like a beagle puppy most likely was born prematurely. Some things that we can find on physical examination. So we look at the ventral abdominal skin. It should be dark pink normally. And it will be dark pink because there's going to be a lot of blood vessels at the surface trying to gather heat from outside sources. If they are bluish, we call that cyanosis. And that means they're not having enough tissue oxygen perfusion to their tissues. If it's dark red, that could mean that they're septic or they have bacterial infection throughout their body. There should not be any discharge from any orifices, so nose, mouth, ears, rear end, that should all be clear of any discharges. Want to check their body symmetry. Everything should be the same. If you draw a line from their tip of their nose to the tip of the tail, left and right halves should be the same. We also want to look at body conformation. There are certain things that we look for. Number one, on the head, an open fontanelle is where the flat bones of the skull are supposed to come together. Should be a very small opening by the time they're born. Should not be open. You can actually see the tissue, the soft tissue coming out of the cranium on this little teacup Yorkie puppy. It is something that breeders have been breeding for, this rounder head, which means that we may not have complete closure on the skull. That is abnormal. This is not normal, even a round-headed puppy. That is abnormal, should not happen, because if this fontanelle, the brain casing, is open, that means that we have soft brain tissue under a very small layer of connective tissue. So that's open to the outside environment to a certain extent, and you can have some damage pretty easily if there's any head trauma. On the neck, we want to look for esophagus. Ectopic heart. Sometimes the heart outside of the chest. That's abnormal. Or a goiter. A goiter is an enlarged thyroid due to increased levels of iodine. That should not be seen. Thoracic malformations, malformations of the chest. There's something called pectus excavatum. That means that the sternum is not completely fused together, and so you have a deep indentation in the chest. Swimmer syndrome. This is a picture of swimmer syndrome. This is when they have no the muscles of the chest, of the pectoral muscles and the muscles of the abdomen have not fully formed or attached in some way, and they are not functional. And so we get this swimmer's pose, so it looks like they're swimming on water, and they just don't have the strength to stand or really to move. Now, this is something that many breeders will euthanize for, but it's something that physical therapy can help these puppies to recover, but it does take some pretty aggressive physical therapy. The abdomen, we want to look for bloating. We're going to look for any defects like an umbilical hernia, that's abnormal. What's called a patent urachus, which is when the urine drips through the umbilical cord. That means that the way that the urine would come out when they're a fetus would be through the umbilical cord, but then their urethra is the way that urine should come out normally. But with the patent urachus, the urine is actually dripping out the middle of their abdomen. And cannibalism. Look for signs of cannibalism. That's not a defect per se in the puppy, but it indicates that there may be something going on with mom, either her relationship with the puppies or that she's sensing something is wrong with the puppy. So we look at the abdomen for that. Look on the dorsum for spina bifida. Spina bifida is when the spinal cord develops outside of the spinal column. And look at the tail. There should be good tone, should have a decent length, or the appropriate length for the breed. Look for any curliness or kinks. Severe kinking in the tail can be a defect that causes some problems later on. Some things that we're going to look at developmentally. They're going to sleep 80% of the time. They're going to nurse every 2 to 4 hours. They'll have absent neuromuscular reflexes. So if you were to do a patellar reflex or another type of neurologic reflex, they're not going to have a reflex available. They just don't have the nerves, have not extended to those and matured enough. Motor skills should be present. They should be able to lift their head by 3 days, crawl by 1 week, suckle, and vocalize. Obviously, they should be suckling as soon as they're born. I do have videos interspersed within this lecture so that you can look at what do they look at like week 1, what do they look like week 2, week 3, week 4. And a lot of times when I'm aging a puppy under the age of 5 weeks, I'm looking at these developmental landmarks. And then I start looking at teeth. They should be able to respond to stimuli, odor, touch, and pain. Their elimination is initiated by the dam, which means that she is licking their rear end in order to get them to urinate and defecate. And she will eat that so that it removes the scent of puppies in the nest so she doesn't have to worry about predators. We can start to look at some sex determination at this point. When they're teeny tiny guys, it's really hard to tell if it's a round hole or a slit. So we look at the distance between the anus and the genitals. So for kittens, because their genitals are on the same surface of their anus, for puppies it's a lot easier to tell. But you can tell this is a male because the distance between the anus and the penis, the penile opening is greater. That leaves room for the testicles. The female, it's going to be much shorter. It's a lot easier if you have males and females in the litter, so you can you can look at the difference between them. All right, second week landmarks, they're going to begin to crawl. Their body temperatures are starting to rise toward adult levels, but they still cannot control their body temperatures. They should have doubled their birth weight. Their eyes should start to open, and their ear canal should start to open. So this is puppies at 2 weeks of age. When we're obtaining blood samples, typically we go for the jugular vein because it's the biggest one that we can get. But on occasion, we actually have to penetrate their bone and go directly into the bone marrow. That's called an intraosseous sample. Uh, we want to make sure that we weigh them, and we want to get less than 10% of the circulating blood volume per week. So we're going to get a small amount. Urine samples to stimulate urine, we're going to either gently express the bladder, or we're going to um, just stimulate them like mom would. And there's a video here on how to take care of that with an orphan kitten. We do not want to do cystocentesis to get a urine sample because their bladders, they just don't have the healing function that we do in our bladders. If somebody were to stick a needle into an adult bladder, it would seal up pretty quickly. When we're taking x-rays of these guys, we have to reduce the kilovoltage to half of that for an adult, because otherwise you get just everything just is, you blow through everything. So want to use really high detail films, or when you're using a digital, it makes it a little bit easier to adjust this, but you have to just be really careful to not blow completely through this tissue, because it's pretty it's not as dense as it would be for an adult. Also, we have to realize that their fat is really different. They have what's called brown fat, and so their fat looks really different. It looks like there's just fluid throughout the whole body. The other thing you may notice is that these bones don't seem to join really well, and part of that, and you can see these lines between these bones here, those are growth plates. That's where that's just cartilage at this point. You can't see the cartilage, you can see the bone. It's just where cartilage has not turned into bone. That's why babies are so flexible when they're born, is they have a lot more cartilage than bone. So routinely, healthy neonatal puppies and kittens require almost no care from the veterinarian or from the human during the first few weeks of life, as long as we have healthy mothers that are taking care of them. You do need to make sure that moms need to have proper nutrition, and that if she's not feeding babies correctly, that we need to be on top of that as quickly as possible. There are some preventive medications and vaccines that are important to make sure that the moms are healthy. And we need to make sure that we're keeping an eye on behavior problems, so that if we have a growly little puppy, that we're nipping that in the bud as soon as possible. Now, we typically don't have that problem if we have good moms. Moms will not allow their puppies to growl. That's inappropriate for their babies. They have no rights as babies. They may growl at each other, play in play, but should never turn into aggression at that age. If it's turning into aggression before 6 weeks of age, we're going to have an issue with that puppy. Before 12 weeks of age, that's going to be a problem with that puppy. Neonatal illnesses, some things that are going to require your immediate attention. Hypothermia is when we have lower than normal body temperature. We need to gradually warm them up. Dehydration, it's very easy for these guys to become dehydrated. They don't have a lot of reserves. Also hypoglycemia, so low glucose. Again, they don't have a lot of fat reserves, tissue reserves of glucose, so they need to eat every 2 to 4 hours, right? And if they get any diarrhea or not eating properly, they're going to get dehydrated and hypoglycemic very quickly. Malnutrition, I'm going to say that next because that kind of goes along with the dehydration and the hypoglycemia. So if they're not getting the right nutrition, mom's not eating right, they're not nursing correctly, or you're not feeding the right formula, that's going to cause problems. Too much nutrition is just as bad as not enough nutrition. So do have to be careful about overfeeding as well. The last thing I'll talk about is neonatal isoerythrolysis, and this is in cats, and this is a problem with cats where the parents have different blood types. So you may know if you've been a parent or you been a child of a parent, that we have different blood types. And if two parents get together and one has a positive and one has a negative blood type, then the baby has to be monitored very closely after birth to make sure that the mom's antibodies aren't attacking the baby's blood. This is what happens with kittens. If mom and dad have a different blood type, then the mom's antibodies that the baby gets from nursing and from the placenta may, as they are shortly after they're born, may attack the baby's immune system. So we have to be careful about that colostrum. Body temperature. Normal neonatal body temperature management. The neonates depend on the proximity to the dam to maintain thermal balance at first. They don't get shivering and vasoconstrictive mechanisms until about 6 to 8 days. It's not until about 6 weeks of age until their body temperature is actually similar to adults. Before that, they run pretty cold. Hypothermia is a problem because it will slow gut motility and decreases blood temperature. It also then inhibits cellular immune function, so everything kind of shuts down with hypothermia. Body temperature for hypothermia depends on age. So if at birth, if it's less than 94 degrees Fahrenheit, that's hypothermia. If it's 1 to 3 days of age, then less than 96 degrees Fahrenheit, and less than 1 week of age, less than 99 degrees Fahrenheit. Those are all considered hypothermia depending on their age. Some signs of hypothermia: neonate with a temperature of greater than 88 degrees Fahrenheit. So if they're greater than 88, but they're less than 94 to 99, what we'll see is a kind of a restlessness, crying. They may have red mucous membranes. Their skin will be cool to the touch. The respiratory rate will be a little high, greater than 40 breaths per minute, and their heart rate will be a little high, greater than 200 beats per minute. Body is trying really hard to warm them up. So anything between first sign of hypothermia, that's what you're going to see. Now, when you go below 88 and you're at 78 to like 85, they're going to be lethargic. They'll be uncoordinated but responsive. The respiratory rate will lower to 20 to 25 breaths per minute, and the heart rate will be less than 50 beats per minute. So they'll start to lose the ability to function. At below 70 degrees Fahrenheit, they are going to appear to be dead. If you are able to arouse them, then you can try to warm them up. And typically, warming up means that you need to vigorously rub them, that you need to put them in a warm place, that you might run warm fluids through an IV. Those are all different ways that we can warm them up. Dehydration is any disease process or an imbalance of fluids can lead to dehydration. They have a high requirement for fluid, so we want to make sure that they're getting nursing frequently. They are also less able to conserve fluid, so any sign of diarrhea or even kind of loose stool can lead to dehydration really quickly. All fluids should be warmed to about 98 to 99 degrees fluid before being administered, so whether we give it subcutaneously or IV or intraosseously, then we're going to want to make sure that we warm those fluids to a certain degree so we don't cool the animal down, because then that's going to lead to hypothermia. Hypoglycemia, great risk for that because they don't have a lot of glycogen stores. Glycogen is glucose, which is stored in the tissues. Also, the liver doesn't make a whole lot of new glucose from digesting food, so poor gluconeogenesis, that's the making of glucose. A healthy neonate can maintain normal blood glucose concentrations for up to 24 hours without nursing, but if they don't nurse after 24 to 36 hours, that's going to lead to hypoglycemia. It's the most common cause of seizures in these little guys. If you see a seizing baby, then that's probably what's going on. They'll be pale, drooling, lethargic, have tremors, be crying and irritable, have an increased appetite, and this can lead to coma and then death pretty quickly. It's actually easy to treat hypoglycemia if you can get them in quickly enough, as long as you can get into a blood vessel. You can inject 50% dextrose at a certain dose, and they'll recover very quickly. If they can't get in right away, have the owner rub some honey or some Caro syrup on the gums and get them in as soon as possible. And then we have to find out why they're hypoglycemic. Neonatal isoerythrolysis. Okay, so I'm going to explain this. This is what happens with the blood type. What happens is if we have B queens, so what are B queens? B queens are the female, the mom of the cat. Blood type B queens are most likely British Shorthair, Devon Rex, or Cornish Rex. So type B are mainly British cats. Okay, so these are the pictures of British Shorthair, Cornish Rex, and Devon Rex and Cornish Rex cats. 25% or higher risk of having a blood type B. Type A cats would be a domestic Shorthair, American Shorthair. So if you have a British Shorthair mom and a dad that's a domestic Shorthair out running around here in the United States, then the chances of their offspring having a neonatal isoerythrolysis is 25%. So 1 out of 4 kittens is going to have this problem. So what happens is the bee queens will have high levels of naturally occurring antibodies against type A red blood cells. So the tom and if any affected kittens are type A. So what you'll see is jaundice and death within the first 2 days of life. We don't want to see that. So if you have a blood type B cat, and if you're breeding your cat and it's any one of these breeds, then you want to, especially these medium to high risk breeds, that you want to know your blood types. You want to know the blood type of the mom and the dad. If mom and dad are both the same blood type, you don't have anything to worry about. But if they are not, then you want to test all the kittens at birth before they get colostrum. What you're going to do is you're going to remove from the so they don't get colostrum, and you're going to tube feed them. Now these guys might be a little bit immunocompromised because of this, so we do have to be careful with them. Malnutrition. We want to make sure we're maintaining good hydration. We can use good milk replacers that are specific for cats, kittens, or puppies. The best way to do it is actually tube feeding. You can give them an exact amount to get it directly into their stomach, and you don't have to worry about them aspirating through a cleft palate or because they're trying to breathe and they're sucking too much fluid down. So this can be one of the best ways to do it, especially for the first week or so of life. First off, anytime we're placing a tube in a patient, we need to know how big that tube is, how much we want to insert. We're going to insert it, mark the insertion to the 13th rib, so the last rib, and mark that where it's going to end up. Insert it to that point, and then put in just a small amount of the correct amount, I should say, of the formula, and it's based on weight. So how much formula is based on how big the puppy is. Puppies tend to tolerate this really well for the first week or two of life, and then they're usually good to go with nursing. So this is a good way to do this with small puppies, kittens, and wildlife as well. Big thing is not to put that tube down the trachea. You put it down the trachea, it's going to go into the lungs, and that's going to kill the puppy. Fading puppy kitten syndrome. So these are puppies or kittens that seem to be born just fine, or they might be stillborn or weak at birth. They don't eat well, so they're anorexic, they're lethargic, may become emaciated very quickly, that you may actually see some birth defects. A lot of times, if we have no idea what's causing it, we want to do a necropsy or an autopsy of the puppy to make sure we know what's going on. Some causes could be poor management, malnutrition, inappropriate environmental conditions, congenital or genetic defects, and infections. So we want to look for the cause, make sure it's not going to happen in future litters or with anybody else from the litter. If you have an orphan puppy or kitten, it can be a lot of fun and a lot of work to take care of. So any of you have done this before, you can share your experiences with the class when we have it. You're going to need some warm, clean bedding and a lot of changes because they do mess their area up pretty well. Milk bottles, nipples, a lot of different types of nipples are really helpful because not every kitten or puppy likes the same type of nipple. Some feeding tubes might be necessary, some syringes, a gram scale because you need to keep an eye on how fast they're growing or if they're maintaining weight, cotton balls, a heat source, hand sanitizers, fur clippers. The fur clippers might be necessary for getting diagnostic samples, but also we can use fur clippers to, if we need to tell one baby from another, we can clip certain parts of their fur. It'll grow back, but it'll help us to identify them. We want to maintain an ambient temperature. That means their environmental temperature for the first week between 84 and 90 degrees. The second week should be between 79 and 84 degrees. The third week should be between 73.4 and 79 degrees. So gradually decreasing the temperature as they are able to maintain their own. Make sure they have clean, dry housing, proper nutrition and supplementation. And then for the first couple of weeks, you're going to be stimulating urination, defecation after each feeding. And I've got that video to show you how to do that. Milk replacers, you want to have a really high quality commercial milk replacer available. It's really important that you use the milk replacer for the species that you're trying to help. It's really hard to substitute some formulas for some species. For instance, rabbits have a really, really high fat content, and you cannot use kitten or milk replacer for rabbits. You cannot use dairy milk for any of these guys. You can't use goat milk for most of these guys. So it's really important that you stick with what is made specifically for that species. Every energy density is going to be a little bit different. If you decide to use a homemade diet, you want to stick to really proven recipes by good sources, not Facebook or Google. You have to be very careful with that. Feeding the neonatal puppy kitten, you have to be real careful not to overfeed. It can cause diarrhea, which will then lead to malnutrition and dehydration, hypoglycemia. So you have to be real careful with that. You have to be careful with underfeeding because then you have dehydration as well and a lack of weight gain. You want to use appropriately sized nipples depending on what you are trying to nurse. And again, you're going to have animals that have different preferences as well. Because of the difference in size, medications are not, and the way their livers are developing, medications are not metabolized at the same rate as in adults. And so you should have a different way of medicating kittens and puppies, and you have to be very, very careful when we're administering medications to them. Okay, we're going to talk about foals as well. And again, there's a bunch of learning objectives that I'd like you to go through so you understand what we're trying to get at when we're talking about the difference between this. And why am I talking about foals in this when I'm talking about small animals? Well, equine horses are companion animals as well, and foals tend to have more neonatal problems than other farm animals. So we're going to start talking about the mares. Now, mares, bringing a foal into this world is not an easy thing, and they have a very high rate of loss, so foal loss. So we want to watch for these high risk problems with mares. The other thing is that once a mare goes into foal, they really, as soon as you see the water break, that foal needs to be on the ground in 30 minutes. If you're not seeing the foal on the ground in 30 minutes, you're probably going to have some problems with a foal. So not only that, but with a mare as well. So we want to look for these problems before they happen. So some indications would be if you have any vaginal discharge. If it's not clear discharge, like the water breaking, and that is a big discharge, so there should be no question that that's what's happening. But any other discharge that's happening that the mare is obviously not in labor, that's a problem. If there's udder milk dripping or streaming, unless you know that she's going to deliver within the hour, that could indicate that she has placentitis or that she has twins. And if she has twins, that might mean mean that we need a surgical intervention. So we have to be really aware of that. If we have any problems, the way that we take a look at them through ultrasound, because they are such a big animal, is to use a transrectal ultrasound. So we're going to clear out the rectum, clean out their colon, and actually use an ultrasound that's designed to fit inside their colon. And you put your hand up in the colon with a glove and the ultrasound, and you can actually take a look directly through the colon into the uterus that way. If the mare has had problems with a previous delivery, chances of them having a problem with the next delivery are pretty high. If they are a high-risk mare, we want them at a foaling facility or a veterinary hospital where they're used to dealing with this. We usually we'll have a video camera to monitor behavior because mares are really good at stopping labor if they feel like there's a predator in the area. So if a human walks in and they're not really comfortable with the human, they can actually stop their labor. So we'll use telemetry to monitor heart rates, which means we put a device on them, and in the next room on a computer we have those heart rates beeping. So we're going to sit in another room, use a video camera, use wireless ways of monitoring heart rates. In order to attend a high-risk mare, we need towels. We need a stainless steel bucket or a nice clean bucket, something we can really disinfect, warm water, chains, a lot of lubricant, some 1% iodine solution to put on the foal's umbilicus as soon as they're born. Sometimes we need an EKG machine or a capnograph just to check to make sure mom and baby are doing okay. Also having some endotracheal tubes for the foal. To make sure that that we can get a line into their lungs and provide oxygen, either through an ambu bag or some oxygen supply. IV catheters and supplies to put in an IV catheter, some fluids, syringes, blood tubes, needles, glucometer. I want to make sure that we have enough glucose, and a tail wrap for the mare. The tail wrap keeps the mare's tail out of that area that really needs to be kept clean. Some signs that that we have a birth that is just about to occur. The udder is going to fill with milk, and you'll get this, the colostrum will wax the teats, so it'll kind of drip a little bit out of the teats and then dry, so it looks like wax. The vulva will elongate, so everything will kind of relax back there. The pelvic ligaments will relax. She may waddle a little bit more. It may be based on what she's done in the past, so she'll have similar behavior changes, and she'll have a similar length of gestation. And with horses, it can go anywhere from 335 days to 365 days to maybe even a little bit longer. So there's like a month difference between when you think she might have it and when she actually has it, and so we have to be really patient with that. We can test her colostral calcium level, so we can milk a little colostrum out, and once it gets to the calcium level gets to 10 to 12 millimoles per deciliter, we know that we have an impending parturition. Also, she will change right before she gives birth. She'll either become more agitated or more docile, and she will start to sweat around the shoulders. When she starts to sweat around the shoulders, that foal's going to come within 30 minutes. Stage 1 of labor is when you start to see those behavioral changes: agitation or becoming more docile, pacing, nickering, lifting the tail head, kicking at the abdomen, turning and biting at the sides. Kind of looks like colic, but any colic is abdominal pain, so that's what's happening. Stage 2 of labor in the mare, and I do have a video that you can watch to see what happens. The placenta will rupture. Allantoic fluid escapes. That's the is a very forceful labor, and that foal should be delivered within 30 minutes. If it is not delivered within 30 minutes, then we need assistance or cesarean delivery immediately. Story. A friend of mine called. She had not realized that the person who was boarding at her farm had gotten her mare pregnant. She had done it on purpose, but she didn't tell the person that she was boarding. and then until it was pretty late in the pregnancy. About a month before she was due, or even a couple of weeks before she was due, my friend said, "Hey, you know what? I think she's pregnant. What do we need to do?" And I told her we need to have a nice soft stall. We need, so we need to kind of, if you know when she's due, then you need to have these things in place. So I try to help her prepare. Well, was maybe a week after that she called and said, "We are not ready, but she's foaling," and it's been 10 minutes. We've been able to see the hooves for like 10 minutes. I was 15 to 20 minutes away, so I immediately stopped what I was doing, got in my car, and headed out there. With very little in terms of supply. I had a stainless steel bucket. They had water. I had some gloves. That is basically what I had. I think I had some lubrication, and they had iodine. So I get there, and there's still just the little front feet sort of hanging out. Mom's trying to push, but isn't pushing really hard. By this time, it's been 25 to 30 minutes. They had not prepared the stall. They had not done anything else. But there was no choice. We had to get that foal out. We didn't have time to spread hay. So within 30 minutes of that phone call, 35 minutes of that phone call, I had my hands on the hooves. My sister was there. Actually, she came with me and was able to help me. And we had to, every time Mom pushed, we pulled. And we had to deliver that foal, who happened to just be very big, and it was a first-time mom. So we had to deliver that foal pretty forcefully, and it took us probably 5 to 10 minutes to get it out. She did come out and wasn't breathing right away, so we had to clear her airway and rub her down with straw as quickly as possible and towels, and then stripped the umbilical cord of blood and broke it, tied it off and broke it, and then put some iodine on that immediately. Stage 3 is when we have delivery of the placenta. So it's really important, and this is what we did as we were watching the baby start to gain its legs and start to walk around. We're watching Mom for delivery of the placenta. That placenta needs to come out in its entirety. If any of it is left inside the mare, then that is going to rot in there and cause a major infection and problem. So I have a video here on how to examine an equine placenta that you should watch and take a look at that. You want to make sure there's no tears, no missing pieces, nothing that has been left. If it's been left in Mom, then Mom needs to be flushed out and treated. After parturition, so what do we do with this baby foal? We want to provide fresh water for Mom, additional bedding, because baby's going to fall down a lot. We're going to look for any postpartum complications, any extra bleeding, pain, etc. And we want to let them bond. It's really important that Mom and the baby bond as much as possible and as quickly as possible. First 24 hours, within an hour or two, they're going to be standing and trying to suckle. Want to allow them that time. Now, you may take the first 15 minutes or so examining the foal, rubbing it down. You could put a halter on it, take the halter off, rub it down with a plastic bag, kind of get it used to being felt with its hooves felt, etc. But you want to then let it be with Mom. One other thing I want to say is when the baby comes out, and I don't know if you can see it, the hooves are going to look like feathers. Let's see if I can, this is only a minute long. I want you to kind of see if we can see the hooves coming out. Okay, trying to get this to the point where you can see the hooves coming out. And the hooves are covered in this feathery-like material that's really soft, and it protects the, it's not really feathers. It kind of looks like feathers, but it's tissue that just protects the the uterus from damage. And now we can see the baby coming out, and I'd like you to, again, to watch this on your own. This is just not going to show really well. I just see if we can see some of those feathery hooves that are protective. And then as they walk, they wear that up, but they can be pretty slippery. If we can see that. There's some, yeah, you can barely see it, but there's some feathery stuff here on that. But if you blow this up and you watch this, you should be able to see that pretty clearly. So, and that will then they'll wear that off as they walk around. So there should be nursing really successfully within 6 hours. They should urinate around 12 hours. And then meconium is going to be before that. It'll be within the first few hours. As soon as they suckle, that gets the contractions working in their GI system. And meconium is the first stool, which is all the digested stuff that they've swallowed in the placenta. So it'll look green and tarry, kind of greenish black and tarry, and it's really thick substance. But we need to see that come out because that means their GI system is working. Within 24 hours, they should be strong, alert, and capable of running. And they can be really strong, and they can hurt you really quickly. So you got to be careful with them. Normal physical exam. They should be bright, alert, and responsive. Temperature should be between 99 and 100, and they will be able to regulate their body temperature pretty quickly. Their pulse is going to be between 60 to 80 beats per minute, so like a really large dog. Respirations, 10 to 20 breaths per minute. Mucous membrane should be pink and moist, and they should have a normal capillary refill time, and they should have open and bright eyes. Heartbeat should be strong, regular, respiration steady, abdomen should not be distended, should not be any discharge from any orifices. They should nap 10 to 20 minute periods and nurse 5 minute in 5 minute periods. They should be gaining 2 to 4 pounds a day. They are going to look a little funny when they start to walk. They're going to start with a base-wide stance with really exaggerated steps and jerky movements. Give them a little bit of grace here. They'll look funny, but within an hour or two, they're going to be walking like they're pros. That's pretty amazing. We're going to apply this 1% iodine to the foal's umbilical remnant at birth and 3 to 4 times a day for 2 days. That's going to keep them from getting any bacterial infection into their bloodstream, into their umbilicus. The most common problem that we see because of the environment that they're in is Clostridium tetani, which causes tetanus, which is a rigidity, causes a toxin to build up in their muscles and causes rigidity of their muscles. So they can't walk, eat, anything. So we want to monitor their attitude, appetite, urine production, and fecal production. We want to administer this tetanus antitoxin if we can get it. Right now, it's been pretty hard to obtain. But if we can get tetanus antitoxin, we want to give it to them. Within a week or two, we're going to be, actually about 5 weeks, we're going to be giving them a tetanus antibody vaccine. We do want to measure the foal's antibody levels 12 hours after delivery. Now, if they are obviously nursing really, really well and got plenty of colostrum, they should be fine. But if there's any chance that they didn't get the colostrum in time, we want to measure these antibody levels. The problem that we see is a failure of passive transfer of the Mare's antibodies, which means their immune system is worth nothing. They are susceptible to every and any disease that is out there. They do make a SNAP test for this, so if you've seen a heartworm test, SNAP test, it's an ELISA test. You put in a blood, the reagents, and you snap it down, and it'll give you a reading of we want to see more than 800 milligrams per deciliter after 24 hours. Anything less, their IgG is an immunoglobulin type G. Anything less than 800 milligrams per deciliter means they don't have enough of the maternal antibodies to protect them against disease. Hospitalization of the foal. Because foals can be prone to infection if they don't get high quality colostrum within 24 hours, that's failure of passive transfer, they can get bacteria, viruses through GI tract, respiratory tract, or umbilicus, so they may need to be hospitalized. So what do? We get the foal's history. When were they born? What were they doing? Mare's history can be helpful too. Their body weight, because we're going to be weighing them frequently, we need to get a starting weight. Quick assessment of attitude and condition. Start them on total parenteral nutrition. That means we're giving them, placing a jugular catheter and starting them on nutrition through their blood vessel. Cardiovascular assessment as well. We need to know what's going on with their heart and their vessels. We're going to get some diagnostics, so arterial blood gases, a CBC, chemistry, blood glucose, do a blood culture to see if we've already got infection, do immunoglobulin levels, fibrinogen, which tells us how much inflammation may be going on, and then lactate also relates to metabolism of glucose and energy. So some things that are, when foals come into the hospital, it's usually pretty serious pretty quickly. So they go into an ICU, foal NICU kind of thing. They may get oxygen, jugular catheter, IV fluid therapy, broad spectrum antibiotics, and ointment on their eyes because they don't close their eyes really well, some thermal support. They get turned, they get supported. We try to keep them up on their chest so they can breathe well and try to get them up and walking. Here's mom. This is to keep baby safe from mom, but mom's there to keep an eye on baby. We may also need to get blood pressure, lots of glucose measurements, lots of urine chemistries, thoracic radiographs, ultrasound, abdominal discomfort, serial blood count, gases. This gets expensive really, really quickly. Here's just a setup for hanging bags and running fluids. Nutritional support, blood pressure, treatment for orthopedic conditions, ventilation. Sometimes we need to breathe for them, and then physical therapy. So lots of stuff. Some potential complications. If we have nosocomial infections, those are infections they get from the hospital. So if we have bugs in the hospital, superbugs in the hospital, they could get infected with that. Any new sites of infection, they could get corneal ulcers or decubital ulcers, but not if you're a good foal nurse. So nutrition and feeding of the foal, they need 130 to 150 kilocalories per kilogram per day. That's a fair amount of energy that they need. So we can, if mom can nurse them, great. If mom can't nurse them, then we can use a nurse mare. That's a mare that's just stopped feeding another foal or is feeding an older foal or has lost her foal. We can do bottle feeding or bucket feeding. Just have to train them to one of those two methods. We can also tube them with a nasogastric tube, and we can also use IV nutrition as well. So foals can be pretty, if they don't get the colostrum, that's the big thing. They have to be hospitalized, and it's a lot of expensive care. But if we can keep them with mom and we have a normal birth and they can nurse right away, they can do pretty well. You just got to keep them from getting any infections. If you have any questions, please let me know and we'll go over them in class. Thanks.